The federal government shutdown is now officially the longest shutdown in history, now in its 36th day.
Transportation Secretary Sean Duffy delivered a warning to Democrats in Congress that if the shutdown continues into next week, there may be more severe consequences.
If you bring us to a week from today, Democrats, you will see mass chaos, you will see mass flight delays, you'll see mass cancellations, and you may see us close certain parts of the airspace because we just cannot manage it because we don't have the air traffic controllers.
Right now, about 13,000 air traffic controllers are working without pay, and nearly 50% of major control facilities are facing staffing shortages. Now, on Friday, 80% of the New York area staff had called out.
Now, despite the warnings from Duffy, liberals in Congress are pushing Democrats to hold the line. CNN reports that roughly a dozen Senate Democrats have signaled they are willing to support a stopgap bill in exchange for a future vote on health care. But some on the left are urging those Democrats not to cave. Bernie Sanders told CNN, quote, "If the Democrats cave on this, I think it would be a betrayal to millions and millions of working families who want them to stand up and protect their health care benefits." And Senator Chris Murphy backed him up, saying, quote, "I think we're suckers to believe that a party that is opposed to extending the subsidies now is all of a sudden going to be supportive of that a month from now."
Well, I don't know what else they want. They don't have the power to enact these healthcare changes. What they need to do is vote to end the shutdown in exchange, yes, for a vote later, maybe a symbolic vote, whatever, on the healthcare policy they want. We'll work on healthcare later, but this is getting ridiculous. The American people are going to suffer because of this. With holiday travel plans disrupted, holidays coming up, it's time to vote to end the shutdown. And I predict the Democrats will. I think they'll do the right thing and will fall in line and do that.
Now, we've seen thousands of government workers be affected from air traffic controllers. The popular story that blew up of the one that had to work for DoorDash, and DoorDash jumped in and gave him some money to help him out in the interim. We know that government employees are affected. When you start to affect everyday Americans with things like you said, holiday travel, which may be a huge inconvenience as people go see their loved ones on the time they've already scheduled off that they may or may not be getting paid. This is when everyday people who are not attached to DC in the same ways that federal employees are going to get really annoyed and stressed out because they have to move and shake a lot of things in order to get comfortable in life. So I think that both parties are going to have to look at this and figure out what the next steps forward is. I've been clear that I don't think the government shutdown is a great idea. Whenever a shutdown happens in the government, either side does it, that it's a failure of Congress to do its job, and people on both sides of the aisle have been critical of Congress for doing that. But if I were to explain and say why Democrats continue to hold the line, it's because they understand that simultaneously, as we talk about what's happening right now with SNAP benefits being cut and with possible delays in flights, we are going to have a conversation in a few months where people actually can't afford health care anymore. And they look at people's premiums going from $800 to $1,900, according to KFF study, which is an independent policy research company. And they're looking at these numbers, and we're literally in the middle of open enrollment, and people are saying, well, I can't afford that. So then how do I keep health insurance for my family? It's a broken system. And there's a lot of people, even Marjorie Taylor Greene, which I'll talk about in my lens, going on different programs saying, yes, we didn't like Obamacare. That's fine. It's been instituted for like a decade now. So what's the plan forward? Because she's not hearing Mike Johnson or anybody come to the table and say, we'll talk about healthcare in these ways. Be transparent with the American public. If we could see what the conversations are, perhaps people won't be getting so riled up about their Republicans doing nothing and Democrats just simply holding the line to hold the line. What are the dialogues happening here? What are the conversations happening? I think both sides of the aisle need to really say that, because people are naturally already don't like Congress, and this is just really exaggerating that feeling.
Yeah, and the system needs reform. I agree with that, but we just can't let the government remain shut down any longer in the interim. We gotta start paying the air traffic controllers. We gotta get people their SNAP benefits that they're expecting. This is not a way to do policy, is in this kind of like hostage-taking experience. So,
and nobody would not work for now a month more, 36 days and not get paid. I don't know one person that would say, okay, no problem.
I would not.
Yeah, I don't know how. So that's kind of a lot to ask for people that have nothing to do with this back and forth. Next on Rising, Marjorie Taylor Greene appeared on The View yesterday. I'll be talking about that conversation in my lens.